Dr. Doreen Grand-Pichet is the
Dr. Doreen is an expert in autism.
Doreen Grand-Pichet.
Dr. Grand-Pichet.
Dr. Doreen Grand-Pichet.
Dr. Doreen Grand-Pichet is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen. Okay, so we have a question. Hi, I have an extremely bright but stubborn 8-year-old boy with a new diagnosis of ASD level 2. One of our struggles is his hyperactivity, fast moving, loud talking, acting silly, not listening. We see it a lot at home, and school was reporting issues with that at the end of last year. He gets a lot of exercise during the summer, but school is starting soon, and I know that it will be more difficult. Should we wait or be proactive and have him take movement breaks during his day? Also, he refuses to do any calming activity or swinging in his special swing. How do we convince him it will help regulate him? And they said, I'm grateful for your show.
Yeah, did you? There were a lot of little things in that one, Shannon. Do I have that question? Because I'm
You
trying to pull up
do.
all the details.
Towards the bottom, it's like in the middle.
Okay.
Highly bright but stubborn 8-year-old. Do you
Oh
see
yeah,
that?
great, yeah. Okay, so new diagnosis at 8, and they say level 2. Again, there's supposed to be two numbers on that, so I'm not sure. Level 2, I would assume, is kind of medium functioning. Um, and it says so, but when you have a child who's just being diagnosed at age 8, that means they're extremely high functioning in terms of the autism spectrum. In other words, they did okay until now, right? I mean, it wasn't noticeable. One of our struggles is his hyperactivity, fast moving, loud talking, acting silly, and not listening. And that is very much defines kind of all the stuff about ADHD. And it's possible that this individual has just basically a severe, a lot of ADHD, because ADHD, people don't realize and I'm glad that we've ended up changing the name of it, ADHD. It used to be just a hyperactivity, but it isn't hyperactivity alone. It's also a lot of inattention, right? And that kind of sometimes people confuse ADHD with ASD because the child is inattentive and distractible, and that's very similar to autism. We see it a lot at home, and school was reporting issues with it at the end of the last year. He gets a lot of exercise during the summer, but school is starting soon, and I know that it'll become more difficult. Should we wait or be proactive, have him take movement breaks? Also, he refuses to do any calming activity or swinging in his special. Okay, so I really feel that you need to address the ADHD. So it's I think it's more about addressing the ADHD, and I don't think he has a diagnosis of ADHD. It looks like you're seeing hyperactivity. I don't know if he's also been diagnosed with ADHD, because once you have that diagnosis, the treatment is dual, right? So it's a combination of cognitive behavioral or applied behavioral ABA type activities, but also with the help of some medication. And of course, people have different feelings about medication for children. But I got to tell you, ADHD is, when it's really clearly diagnosed, is one of those diagnoses that I am a strong supporter of medication, especially the new medications for ADHD. And I'll tell you why. Because it is extremely difficult for children to regulate themselves without the help of those particular medications. And as they grow up and become adults, a lot of other things, they start to do other things to help them regulate. And I don't want to, no cause to scare any parent, but just as an example, children with ADHD who go untreated constitute, are far more likely to have alcohol addiction. And the reason for that is because they're trying to find something to help them calm down. And alcohol is a depressant and it works. So help them calm down by when they're a child, giving them something that will help them regulate. I think for your child, if he's having such a hard time taking like breaks and or doing those things, that is just not helping him perhaps. So maybe focus a little bit more on like maybe talk to a specialist for ADHD. Maybe there are some really good books on how to manage attention deficit hyperactivity with children. And then again, as I said, please talk to a psychiatrist and get some, consider some medication and see if that helps.
And can I make a plug for going as organic as possible and reducing exposure to pesticides? Because
And sugars and dyes, all of that. Yes,
yeah, I mean, studies keep trickling out, but we've known for quite a while that, especially organophosphate, I believe is the one that it shows up, a small amount of it shows up in children's urine and can directly go back to the amount of ADHD symptoms that they're displaying. So, yeah,
absolutely.
organic as possible, as quick as possible. We always encourage you to look at the Dirty Dozen and the Clean 15 on EW.org. They change them every year. That way you can know you don't have to buy everything organic because it gets expensive. But that there are some things that you should never have conventionally grown, especially for your children. But I
Yeah,
think for because they're just doused in pesticides. And I think I've seen in our lives that it's made a difference, and I've heard from so many families that it makes a difference.
definitely. So Shannon, I have one last follow up from Ashwath where she asks, should I send my 3-year-old kid to preschool with the therapist or ABA therapy center or both? I don't want to exhaust her. And I completely get that. I think what you should do at the age of 3 is just have ABA. That's what I would do because when you start, so a couple of things, although it depends on your child's functioning as well. I try to make sure that before my child gets into the school environment, they have enough skills that they can do well amongst peers. I don't want my child going to school and being the only one who can't follow instructions or the only one who doesn't have language or the I want my child to feel a little bit more like they can actually they know, for instance, things like how do I approach a group of children and interact with them? How do I, all those types of important social skills. So if your child has those, then certainly you can have your child in some preschool activity as well as ABA. If your child doesn't have those, your child is very young. So you can certainly do more ABA and then when the child is more like 4, integrate into pre-K, let's say, and then you can do a little bit of each pre-K and ABA. And then when they turn 5, depending on the level and what your child has learned, you gradually increase school as you reduce ABA. But remember, think of ABA, especially for the high functioning child, as just tutoring to help your child kind of keep up and excel, not in their academic skills, because most high functioning kids don't need that, but in their language and social and kind of those soft skills, cognitive skills that are hard for kids on the spectrum.
Yeah, I just want to put a hug on everyone who's got kids going back to school right now, because especially with all of the different changes and
Yep.
some masks, some aren't, it's just harder than ever to
Yes.
know right for your child. I do want to say that tomorrow, Bonnie Yates, special education attorney, will be joining us. If you guys have questions that you want to write in right now or as soon as possible, so I can send them on to Bonnie, because a lot of you are asking, saying, okay, we started school, we don't like how it's going, what can we do? We thought it was going to be this great social thing for our kiddo, but with the masks, it turns out it's not. What are our rights? Feel free to write in what your circumstances are so we can ask Bonnie tomorrow. I I want to thank Dr. Granpichet for being so patient with all of our technical issues this morning. Hopefully, we're going to have those figured out for tomorrow. I want to thank all of you guys for being here. I want to encourage you to please Check out the other videos that we have. We are live the rest of this week, and we are live all next week. Thanks for watching Autism Live. If you found anything helpful in this video, please give us a like. In fact, make sure that you smash that subscribe button on YouTube and give us a like on Facebook. You can also follow us on Twitter and Instagram for important updates. And please download our free podcast wherever you get your podcasts. See you next time. Until then, give your kiddos a hug from me and one for you too. Bye-bye for now.
To subscribe, click here. And if you'd like to check out some more of our videos, click here.